Okay, it is now 7:30, and we are going to begin our Cumberland County Housing First webinar, and we are very excited to be able to present this to you this evening. And I apologize if we have any glitches in advance. We don't promise to be the high tech people here, but we will do our best to convey to you the information necessary on what is happening with Cumberland County's Housing First Collaborative. First, I want to introduce myself. My name is Robin Weinstein. I am the president and founder of the M25 initiative, and I guess the head collaborator of the Cumberland County Housing First Collaborative, which emerged out of the needs that we found through our Cumberland County Code Blue Coalition, which I have been involved with and setting up over 3 years ago. And our eyes have been open to the needs of the homeless around us. And now we wanted to go beyond just providing a Band-Aid solution or a Band-Aid to homelessness through the Code Blue program, but actually look beyond that and what can we do to solve the problem of homelessness in our area. Many people want to tell me that that's an impossible thing. However, it's being done all throughout our nation, and it's being done all throughout the world through the Housing First program. And so we're very excited that we have a collaborative working with all the major nonprofits and so forth, and the hospital and the jail, getting ready to launch a major initiative that's designed to look at ending homelessness by 2020. Now, in case you're unfamiliar, the M25 initiative is a 501c3 nonprofit. We just started in September, but it emerged out of the Code Blue program. And what we saw is that if we could equip and empower the local church to meet the needs of the homeless through the Code Blue program, well, that should just be a start. We can do a lot more when we work together here. And so that is really where we are looking at as the M25 organization. And sometimes people say, well, M25, maybe it sounds like the MI8, the secret society or the CIA of Great Britain, but really what M25 is based on Matthew 25:35 through 36, where Jesus says, "For I was hungry and you gave me something to eat. I was thirsty and you gave me something to drink. I was a stranger and you invited me in. I needed clothes and you clothed me. I was sick and you looked after me. I was in prison and you came to visit me." So these are the core tenets of the M25 initiative. What can we do to equip, empower, and mobilize the local church to meet the needs of Matthew 25? And we do this through innovative solutions and partnerships, which is what this Housing First Collaborative is all about. And so this evening, we are excited that we have with us Caitlin from Monarch Housing, who is our partner with the Housing First initiative. The M25 Housing First Collaborative has contracted with Monarch Housing to prepare our memorandums of understanding and the Housing First program, because we want our Housing First Collaborative in Cumberland County to be established on best practices and deliver data-driven results that can really impact not only the lives of the homeless individuals, but also the lives of every resident in Cumberland County to be impacted by this. So at this time, I'm going to attempt to turn the floor over to Caitlin. So if you want to go ahead and unmute your mic, Caitlin, and I see you unmuted it, and see if you can go up to the screen share button on the left-hand side column, and then you should be able to take over, or I can run the PowerPoint if necessary.
Screen share. Can you hear me?
I can hear you.
Okay, great.
So it should be the second box on the left-hand side.
Yeah, it says I'm screen sharing. Do you see?
Up there we go.
Okay, great.
And then you need to just choose there you
Yep.
go.
All right. So thank you for having me. If anybody is working on the Housing First initiative for Cumberland County, you might know my coworker, Thaisa. She is currently on her way to Trinidad for vacation, so I am stepping in for her a bit. But just to give you a quick background on Monarch, we are a consulting agency that works with 12 of the 16 continuum of cares, and which is 17 of the 21 counties throughout the state of New Jersey. And we pretty much do anything related to homeless planning. So we do go to conferences and try to bring back best practices. And we do a lot of work around funding homeless programs, especially through the continuum of care funding and ESG funding that's allocated through HUD. So what I'm going to go through today, I'm going to give an overview of what Housing First is, how it works, some of the benefits of Housing First, and how some other programs have worked to implement it in their communities. And then I'm going to give a brief update on what the Cumberland Housing First program is working into looking like. If there's any questions, I think we will have some time at the end to probably take any. And I do have some source information if anybody was interested in looking at any resources or anything that's in this presentation. So first, just a basic of what is Housing First. So Housing First is an approach to successfully connect individuals and families who are experiencing homelessness to permanent housing without preconditions or barriers to entry. So a lot of programs that we see, or a lot of traditional programs that we have seen, require somebody to be housing ready. They need to be sober, or they need to be receiving treatment for a mental health condition before they can even access housing services. So Housing First, as implied by the name, is really focused on getting people into permanent housing. This program model can be applied in a variety of ways. So scattered site, which would be throughout the community, permanent housing sites that are already in existence, which is the approach that the Cumberland Housing First program is going to take. It could be single site models to where, one building is built. It could be a tax credit project or something. And then there's set asides, which again could be a one building location, but maybe only 10 of the units is available to the homeless population with subsidies. So some principles of Housing First. Homelessness is a housing crisis and can be addressed through the provision of safe and affordable housing. All people experiencing homelessness can achieve housing stability in permanent housing. Some might need more support, more supportive services wrapped around them. Some might need less. But regardless, everybody is housing ready. And I think that this is kind of the big shift for people when implementing a Housing First program. So like I said, a lot of traditional programs related to homelessness want you to be sober, want you to, complete certain steps in order for you to get a permanent housing voucher or to move into permanent housing. They want to be able to say, okay, now you're housing ready, where Housing First is really saying, let's get you into housing first. Let's get you into your own permanent housing unit, and then let's wrap around the services to really keep you stable there, and to address some of the barriers that have been preventing you from getting into housing in the past. So it's more about programs meeting the clients as opposed to clients trying to fit the mold that a program is looking for, which goes into the self-determination point of people experiencing homelessness have the right to self-determination. And that the exact configuration of housing and services really depends on the needs of the client, and not so much on what a program is willing to offer or is able to offer to a client. So some of the core elements of Housing First, and I'm going to go into each of these a little bit. So Housing First, the main thing is low barrier admission policies, rapid and streamlined entry into housing, separation of housing and services. Tenants have full rights and legal protections, and then lease violation and eviction prevention, which is a biggie for especially the chronically homeless population. So low barrier admission policies, like I was saying, there in a Housing First program, there's really very few programmatic preconditions. Obviously, you have to be eligible for the program as based on the funding source, but really that's it. The idea is to try to get those that are hardest to serve, those that have had the hardest time accessing services and accessing permanent housing, and getting them into housing immediately. They don't need to be required to enter a transitional housing program. And policies are really designed to screen clients in as opposed to screen out. We know a lot of programs, want to choose the clients that are going to be a little bit easier to move through their program and might have a positive outcome with the least amount of work, whereas this program really tries to take those who have the highest level of need and who might have been homeless the longest and figure out how to address their needs. So rapid and streamlined entry to housing. As I said, Housing First, supportive housing models make an effort to help homeless persons move into permanent housing as quickly as possible. So the shorter the amount of time that they're able to remain homeless once they're connected to a program, the better. There's no reason, for a traditional model for somebody to have to go maybe from the street to a shelter, to a transitional, and then on to permanent housing. The idea behind Housing First is let's get this person into permanent housing as quickly as possible, and then we'll wrap services around them. Communities have a unified, streamlined, and user-friendly process for the application instead of people having to jump through hoops in order to actually get into a program, and a coordinated assessment system for matching people with appropriate housing and services. So it's not just somebody showed up on the right day and that's why they got a permanent supportive housing voucher. It's really based on the client's needs and then what services they need to be linked to in the community. Separation of housing and services. So supportive services are voluntary and are not required as a condition of tenancy, but can and should be used to engage tenants to ensure housing stability. This is one that we know is hard for supportive service and sometimes permanent housing providers. They want to say that if a client decides not to become sober or not to, attend that counseling session, that's a mark off on their ability to stay in their unit. Housing First is really saying we need to meet these clients where they are. We need to use techniques like harm reduction, motivational interviewing, and really say, okay, where are you at right now? Let's figure out what we want to connect you with in the community. How do we want to get you to be an active and integral part in a community and connected to the services that you really need to maintain this permanent housing, as opposed to making it a condition on getting or keeping that permanent housing. Obviously, non-judgmental communication and client-driven services, what they're saying. Tenants have full rights, responsibilities, and legal protections. So tenants are educated about their lease terms as opposed to just being forced to sign into whatever terms a landlord is saying they need to sign on to. They're given access to legal assistance and encouraged to exercise their full rights when things might not be working out with their landlords. Landlords abide by legally defined roles and obligations. Many Housing First programs will have tenant associations to review policies and provide feedback, formal processes for tenants to submit suggestions and grievances. So, the best way that some communities have really gotten feedback about their program is from tenants who have been through their programs. It kind of gives them a real, hands-on experience of what are some ways that we can improve the system in order to more meet the needs of our clients. Lease violation and eviction prevention. So like I said, one of the most important services is not only wrapping, substance abuse, mental health services, but just basic living services and skills with the client. And one of that being maybe landlord mediation. So you want to incorporate practices and policies that prevent lease violations. Obviously, we know more evictions, the harder it is to find another unit along the way. So one of the things that agencies who have been successful in implementing a Housing First program have done is really implemented a good agency-landlord relationship. So they're able to, where if the landlord has an issue with the tenant, instead of just threatening the tenant with an eviction, they're able to actually reach out to the agency and say, hey, this is what's happening with this tenant. Can you work with them? Or is there something that can be done in order to prevent them from being evicted, or just to, straighten up the relationship a bit? Landlords tend to like when they know a subsidy is going to be paid or their rent is going to be paid. So we found that as long as that relationship is there, landlords have been willing to give clients, a second chance instead of just evicting them right away. But if it does get to the point where a tenant is going to be evicted, the idea is to try to, instead of just kicking them out of the program, to try to find a unit that might be more appropriate for them. These are going to be some of the hardest to serve populations and clients. So we know that, their first apartment, it might not work out. We know that they obviously have some barriers to housing. So it's really trying to have not a one strike and you're out type of deal. It's trying to really work with them and say, okay, if this situation didn't work out, what can we do to try to prevent this from happening again? And try to find them a new housing situation, maybe in another area with a new landlord. And the key, as it says here, is do not consider alcohol and drug use by themselves lease violations. We've seen some programs that are running saying, you can't have visitors unless they've checked in with people, or you can't, have a visitor stay overnight. And those aren't rules that us as, adults have to live by. And these are adults, they've come into hard times, but that doesn't mean that they need to be necessarily following these strict program guidelines that no other adult would want to live by. So benefits for the consumer. Consumers in a housing first model access housing faster and are more likely to remain stably housed. Permanent supportive housing has a long-term housing retention rate of up to 98%. Between 75 and 91% of households remain housed a year after being rapidly rehoused. And honestly, those numbers are even higher. I just monitored a program today in a community where they've had tenants who have been in the program from its beginning back in 2002, and they're still in a permanent supportive housing program and have been able to increase their income and actually become a really active member of the community because of that permanent supportive housing program. Like I said, a majority of clients participate in optional supportive services. You will obviously get some who don't want to, but most of the time they will take you up on it, and often resulting in greater housing stability. They're more likely to participate in job training programs, attend school, and they also have fewer days that they're in a hospital situation or, going in and out of jail, things like that. For the community, Housing First is cost efficient. This is the biggest push for some communities to get a Housing First initiative, not only to better serve clients, but also it is cost efficient for the community. Access to permanent housing generally results in cost savings. A permanent supportive housing voucher for a unit is cheaper than keeping somebody in a transitional housing program or an emergency shelter program. And it's definitely cheaper than them cycling through emergency rooms or through the jails or emergency shelter placements. Housing First really moves away from a system dealing with problems towards a system of trying to prevent problems from occurring. So I'm just going to go through quickly some examples of Housing First and how it's really been effective. So Mercer County has probably been one of the most effective communities to use a Housing First model in New Jersey. So in 2010, their pre-Housing First expenses, and this is, visits to the ER, jail, prison stays, this is detox centers, mental health centers, and shelter stays. It was approximately $30,239 per tenant per year. After implementing the Housing First program, in calculating all those costs again, it went down to around $18,857, and that includes, expenses for housing, so rent, as well as the supportive services for the client. So that's a huge savings that they were able to see before implementing Housing First and then after implementing Housing First. Bergen County is also another example. So Bergen County Housing, Health, and Human Services Center. It's a emergency shelter that they built, but the center focuses on collaboration with their permanent housing providers and really accepts a Housing First approach. So by the end of 2014, the center had housed over 700 of its formerly homeless clients. And of these, about 20% were one time considered chronically homeless. And the way that they've done it is pretty much everyone who walks through the center's door is quickly evaluated for housing placement. And they try to have service providers actually attend the center so that clients are linked to services before they're even placed into the housing placement. So it's not a requirement, but it kind of gets them on that path so that once they do get that housing placement, they're able to continue the services. So they have veteran services there, case management, housing placement, really anything you can think of. They pretty much have an agency there on site who starts to connect with that client. I will say Mercer and Bergen County both are pretty close, Bergen County in particular, to reaching functional zero for the chronically homeless population. I think Bergen County counted 8 chronically homeless in their point in time count in 2016, which is a huge decrease from the number that they've seen, and they're able to house approximately that amount of clients per month that are chronically homeless. Another example, Greater Trenton Behavioral Health Care. So that was a Housing First program, provides housing to chronically homeless individuals and families. There's no requirements for tenants to participate in services. Support is offered in many areas, like I said, like landlord-neighbor relationships, employment, things that are really, daily life skill focused, and then on top of any recovery services, mental health services that the client is willing to accept. Rental subsidies are provided, 24-hour on-call is available, and Greater Trenton's model has achieved a 78% decline in annual hospital, inpatient, and emergency costs. United Way of Hudson County is just the last quick example that I have. So they were able to, through some funding, provide rental subsidies for clients. They were able to quickly get them into housing, provide wraparound services. They've had huge success in their program, and through that, they were able to actually expand their program so now I think they have a total of 3 or 4 grants that they're able to provide permanent supportive housing for using the Housing First model. So just to go into a little bit of how the Cumberland Housing First program will be set up. So the target population is 50 chronically homeless individuals. So in case anybody doesn't know, chronically homeless, the household, either the head of household or the individual, whichever type of family setup it is, has to be disabled. And they also have to have either been homeless for 1 year, so in an emergency shelter or on the streets for 1 year continuously, or have 4 episodes of homelessness in the past 3 years, and those episodes have to equal 12 months. So they could have been in and out of staying with friends and family, but in the in-between time, they were sleeping in a car or in a shelter, and those total episodes equal 12 months. The main population that we're looking at is those that have interactions with the Inspira Health Network, Cumberland County Jail, and substance abuse and or mental health issues. I know that Gateway CAP is going to be a key referral source as well, as they're the ones who oversees the Code Blue shelter and who interacts with the Inspira and Cumberland County Jail. So all referrals will be generated through those agencies, Gateway, Inspira, Cumberland County Jail, Complete Care. They'll be verifying the chronic homeless status and that they're high utilizers of hospital or the jail, since that's really where we see the most cost savings with these programs. There will be a case management agency, which is the Resources for Independent Living. So they'll really be completing the enrollment application that has to go through DCA and be submitting that for approval. There will be a housing locator, which is really, really key in these programs. Obviously,
Caitlin,
oh yeah.
I just interrupt? Some people don't know the acronyms of like DCA and so forth. If you can share that with them.
Surely. So sorry about that. DCA is the Department of Community Affairs. So they just released the request for proposals for the vouchers that they have available for the Chronically Homeless Housing First initiative. So housing location and stabilization, the housing locator piece of it will be provided by PRAC. So they're really going to be working with the tenants who find units within the area that fit the requirements that DCA requires under the vouchers. They're going to be negotiating with landlords and assist participants through the lease-up process. So they'll be making sure that no tenant is signing into a lease that doesn't make sense, or one where, they're covering everything which the grant or voucher couldn't cover.
And excuse me 1 second, just to help you out there, PRAC is formerly known as the Puerto Rican Action Committee of South Jersey. So some people might not know that one, and just want to make sure everybody knows that.
So PRAC may purchase units for a program or work with other developers understanding of the population, but I think the majority of the vouchers will be used just in units with private landlords that are already available in the community. In addition, there will be some additional community support provided by Revive South Jersey. So their main input into the program will be to secure furniture donations for new move-ins and kind of help people to acclimate themselves in the community. They'll manage community volunteers for providing mentorships and community support. So if anybody, needs anything as far as just community interaction and general relationships in the community, they're really going to be able to provide some key assistance there. And the furniture donations and things is really something that not a lot of programs think about before implementing. So it's great that this program has. I've seen a lot of programs be implemented where they give, someone who's been on the streets for years a permanent housing voucher, and then they don't connect them with anybody in order to try to help them find furniture or to find, housing supply, pots, pans, plates, anything like this. So now you have somebody who's in a brand new place with absolutely nothing. And sometimes we've seen them, unfortunately, go back to the streets because they say, well, at least I have friends and people out there where I have nothing in this apartment. So supportive services, the resources for independent living will serve as primary case management agency. Community-based case management services will be provided by a case management team. So this will include social work case management, mental health specialist, alcohol and substance abuse counselor, peer support. Obviously, like I said in the outline of what Housing First is, all of this will be will not be a condition to them remaining in the program, but will be made available to every client. And it will be encouraged, obviously, for them to participate, but it's really about meeting the client where they are and offering them what's most appropriate for them at the time. Nursing staff will be available for the case to help out the case management team, which will be provided by Complete Care. And case management team will also provide direct services and connect participants to existing community services. So one of the best ways to make a program successful is to obviously link people with services already available in the community. Program oversight. So Gateway Community Action Partnership will serve as the administrative agent for the Housing First program. And Gateway will monitor program progress, assist partners in addressing barriers, and report on program outcomes. I thought that was it. So I think that's all I have. I don't know if there are any questions. Let me to.
I don't see that there are any questions that came through on the Twitter feed, and I think that you kind of highlighted a lot of it. In terms of funding for this, can you hit on that, or I can help you out with that in terms of what we're looking at for how this would be funded?
Sure. So obviously the housing piece of it, the majority of that's going to be covered by the Department of Community Affairs. So DCA is going to be providing the 50 chronically homeless vouchers. So tenants will be able to find units at the fair market rent, and they'll be providing the subsidy. So tenants will only have to pay 30% of their income. So regardless of what their income is, it's only 30%. And that will include utilities and make sure that they, will have enough funding to cover the utilities themselves if that's the way it covers. I believe that some of the agencies are still seeking some of the funding around the case management piece. I think Resources for Independent Living is still looking for some of the funding around the case management. They're looking to hire new case managers for that. And I think some of the nursing staff, like I said, is being paid for through Complete Care since they're a federally qualified health center.
Okay, terrific. Yeah, one of the things that I think that is important for people to recognize is that only a piece of this is funded or potentially funded by the state government through the housing vouchers, and that we do have a tremendous amount of resources that we need to fundraise privately and through our the groups that have been mentioned here in order to support this. And so one of the questions that I had received from someone was, how do I help out with this initiative? And really, we encourage people to go to the endhomelessness2020.com, and you can make a donation there for funds that will go toward this. I think estimation of between $200,000 to $500,000 when this finally gets ramped up to the full 50. But it's important for people to recognize that while this costs money, it actually saves money in the long run, as you hit on. So I wanted to encourage people to do that. And also I wanted to emphasize that we are not talking about building new programs, right, or new facilities. We're talking about using existing facilities. But one of the things that we are concerned about is ensuring that we have that high quality landlord and facility. We don't want to use the term the slum landlords. We're looking at high standards for what we want to put people into. We don't want people to benefit from this program by not providing good services. We want to provide a win-win for everybody involved. And so I want to thank Monarch Housing, and I certainly want to thank Caitlin for your time this evening. And to be respectful of everyone's time, we have the opportunity. No one went on to our Twitter feed, so that's okay, to ask any questions, but people can feel free to reach out to us through that endhomelessness2020.com, and we can answer those questions going forward. But we're hopeful by the end, we have to, by the end of this month, to put forward our proposal to the Department of Community Affairs. And we've asked all the municipalities, and the freeholders I know are voting tonight to pass resolutions supporting this. And again, to emphasize that we're not seeking taxpayer funding right now. And some people ask, how does this relate to the Homeless Trust Fund that was established by the freeholders? And we are hopeful that once that trust fund has generated some revenue, that those funds would be able to be utilized in the Housing First process, because really Housing First is about prevention, and it's about dealing with the issues of homelessness in a very real way. The solution for homelessness is a home. And I encourage people to look at the state of Utah. You can Google it, Google Housing First. There's all kinds of information out there. There's information on my blog, which is accessible again through the endhomelessness2020.com. But I want to thank you, Caitlin, for this evening. I think that you did a wonderful job. And certainly we're jealous of Thaisa, who's going on vacation.
Yes.
She told me she would be she thought she was going to have an opportunity to call in, but I know she's heading in the airport now. So
yeah, she is.
And we thank Monarch Housing for all that you're doing, and we will call it a night. So thank you so much.
Sounds good.
For joining us. Take care.